welcome back to another edition of PharmChats for the summer. We're so excited that you're here. Today we have Dr. Kandis Backus. She is with us she is down at UMC in Jackson, and she specializes in HIV patients and their pharmaceutical treatment. We also have Eric Pham, who many of you know, and he is a pharmacy student at the University of Mississippi. And so we're going to get to know Dr. Backus a little bit more and learn what she does day to day. So Dr. Backus, I'll turn it over to you to kind of introduce yourself, and then Eric can hop right into it with questions.
All right, well, thank you. So I'm Kandis Backus, and I currently serve as Assistant Professor of Population Health Science, which is the third school of population health in the U.S. And I also serve as clinical pharmacist for Adult Special Care Clinic, which is the largest HIV care clinic in the state of Mississippi. And I think that I have the absolute best job in the world. It does not get any better than what I do.
That's awesome. Just to start off, can you tell us a little bit about your background, what college you attended for undergraduate and pharmacy school?
Of course. So I took a very non-traditional route. So I knew that I wanted to go to college, right? Because my parents were kind of like, high school is not the end of the road. You got to get out and go to college. So I first went to college, and I was a science major. So I got my undergrad from Arizona State, and it was in chemistry. And I did a lot of research during that time on I looked at contaminants in water that affected aquatic life. And so I did a lot of that research, had applied to graduate school, and had actually started a PhD program at the University of Mississippi. And I was doing cancer research. And during that time, I did a lot of preclinical studies, and we're looking at different drugs and things that pharmaceutical companies were investigating. And that's when I became interested in pharmacy. And so I exited the PhD program with my master's and went to pharmacy school. And then my third year of pharmacy school, I fell in love with HIV. And then the rest is kind of like history.
That's awesome. So you did pharmacy school at the University of Mississippi?
I did. I went to Ole Miss and graduated in 2017. And then I completed a one-year residency that was a collaboration with Walgreens and an LGBT, which is lesbian, gay, transgender health clinic in Jackson. And then I left there and went to my current position.
Okay, cool. So could you tell me, just a fun question, what was your favorite memory with Ole Miss School of Pharmacy?
I've managed to do some crazy things during pharmacy school. Like, I got pregnant during pharmacy school, not recommended. So my husband lived in Jackson, and I was, of course, in Oxford. So my fondest memory would be every Monday morning leaving my house at 4:30 or 5 a.m. in Jackson to get to Oxford to start the week in school on Monday morning, and then on Friday afternoons I would spend hours driving back. So yeah, that's my I got very good at timing that commute perfect.
Here I am just thinking about commuting from Memphis this semester, so nothing comparable. So what interests you or drove you into pharmacy school, but a little bit more of your influences growing up to pursue in the healthcare and sciences?
So I've always been intrigued by science and kind of how things work. So I always was curious as to how things work and how to make things better. And then kind of as I transitioned from there, there was a documentary I watched on CNN, probably it had to be, I don't know, 10 or 15 years ago. And it was done by this lady, Soledad O'Brien, who's, you probably don't know her because you're young. But the documentary really focused on health disparities, and that's when I really became interested in healthcare. And so I was like, this is the perfect way to mesh my love for science and research with actually helping people. And so from there, I just kind of I really tried to figure out where my niche was, and I started with breast cancer, and then I jumped to HIV, which is not, in the grand scheme of things, it's not a huge leap because they both deal a lot with like inflammation and the immune system. And so it really isn't a huge leap, but I just saw so many opportunities in HIV for pharmacists that when I was first introduced, fell in love with it.
I love that. So now that you're with the HIV clinic, can you tell us a little bit more about your current practice in that and the specialty with HIV?
I work in the HIV clinic, and so my role was undefined when I got there. So they hadn't had a pharmacist in their clinic in 15 years. So when I got there, they really didn't know what to do with me, and I didn't know what to do with myself. So over the course of probably the first 5 or 6 months, I really tried to figure out what did they not have in the clinic that I could bring as a PharmD. And I quickly realized that they did great at vaccinations. The nurses did great at med rec, so I didn't have to worry about that. And then I really started to realize that these patients that were living with HIV, some of their regimens were old, and so I could kind of help some of our nurse practitioners update their drug regimens. And then also, a lot of the patients have other health concerns, diabetes and hypertension, and it's just difficult to address HIV care, potentially sexually transmitted infections, and primary care in a 30-minute visit. And so carving out this true population health, which is primary care for people living with HIV, became my focus, and it has been amazing. I have a great collaborating physician, so I have a collaborative practice agreement. So I pretty much do everything that I want to do. I can start meds, stop meds, I can order labs. I have my own schedule where our patients are scheduled to see me directly. And they're very trusting. All of the physicians and nurse practitioners will send me patients, and they're extremely trusting of my decisions. And so it's been a great, awesome time.
Awesome. So it really you just explain like the different avenues of pharmacy and then how you can tailor your position. Like you said, they never had that pharmacist in that clinic, so you tailored the position on what they needed best and how you can best serve your patients, all of that. So for those who don't really know what a collaborative practice agreement is, would you like to explain what that means and then the benefits when it comes to the duties of pharmacists?
In Mississippi, pharmacists do not have provider status, meaning that we're not able to build insurance plans and things like that. A collaborative practice agreement allows essentially a pharmacist to work under a physician and basically order prescriptions and labs and all of that stuff on behalf of the physician without the physician ever having to see the patient. And that is really cool because our Board of Medical Licensure allows medical doctors to see patients without physically seeing them. And then our Board of Pharmacy allows us to have collaborative practice agreements and operate very independently. So that has been awesome. And it also has allowed me to expand my research. So I do HIV prevention research. So I have a pharmacist-led HIV prevention program that we basically provide preventative care for the entire state of Mississippi, and it's all pharmacist-led.
So that dual role of clinical and research, what would you say is your typical day or week look like? I know it changes so much and there's no exact way, but what does it kind of look like?
So in theory, I am 40% clinical and 60% research, but I think it actually turns out to be like 100% of everything all the time, because I'm only supposed to see patients 2 days a week, but I really try to see patients whenever they're available. So I have slots in which patients can be scheduled to see me any day of the week. And our HIV prevention program is a very much on-demand, patient-driven program. So some days I may have one patient a day or a patient a week that is interested in HIV prevention. And then there are some weeks where I have, 3 or 4 patients a day that are interested in getting HIV prevention medication. So there's never a dull moment, but I think the research part has been the most rewarding because now I'm also operating beyond kind of projects where you have an idea and test them out, which is like implementation science. And so I've moved beyond that, and I'm now getting involved in clinical trials where I am the pharmacist of record. And so it's like we're having these blinded studies, and only I know who's getting the treatment drug versus the placebo drug. So it's been actually very, very cool. I think the research part is probably my most favorite. I learned so much throughout each process. And it's a great place for pharmacists just because of our training. At Ole Miss, we spend a lot of time having to read and research things on our own. We get a very good training when it comes to that, but it makes clinical trials that much easier because we're always asking questions and we're always willing to look for information and search for things. So it's been fun.
That's cool, because especially as student pharmacists now, we're always reminded that we are lifelong learners. So how you can always, you're always learning something new, always new things are coming out. So you just explain how it comes with your expertise, especially with HIV. How would you say COVID-19 pandemic has changed the way you deliver care management to your patients?
That is probably the best question. We have really switched, especially me, I've switched to all telehealth visits, except for there are certain situations where I make house visits. I've gone to give injections for syphilis to patients who aren't able to come into the clinic or don't want to come into the clinic. I have patients that are on continuous glucose meters and they have to change it every 14 days and they haven't quite gotten the hang of it and they're not very good at reading their sugars. So I have to go to their house and change it and read their sugars and go over their foods and all those things. So I think the best way to sum it up is that COVID-19 has forced us to push the envelope. We are probably going back into the tricks and things that, providers were doing years ago when they would make house calls or when you were trying to see like, okay, how long can I push you out before I have to see you? We're making more phone calls, we're doing video visits, and we're really pushing the envelope. Like HIV prevention services, patients have to be seen every 3 months in order to stay on the medication. It's just not possible with COVID. Some people aren't comfortable coming in for lab work. Some people, their particular lab is closed at this time. So we're really getting extremely creative and just trying to figure out how far can we go before we make people come in without stopping their medication. I mean, we're getting creative on having to get medication. I'm like, I feel like I'm a true drug dealer. I'm like trying to find meds for people that are losing their jobs and, are losing their insurance. And I'm trying to like track down meds or I'm trying to like go and like borrow meds and figure out, I feel like a true drug dealer some days because I'm getting very resourceful. So pushing the envelope, I think, is the best way to describe what's happening during COVID.
For a student who is interested in HIV clinical pharmacy, how would you recommend they prepare themselves, and is there certifications or residencies that are required to be in this position?
So there is a HIV specific certification, but I think at the end of the day, it comes down to branding yourself, right? We have so many pharmacy schools. We have so many students that are coming out. You have to figure out a way to make yourself stand out. And for me, I was in a class with a ton of super smart people. I was never the straight A student. That wasn't me. Those were my friends. Those are people I studied with. But what I tried to do is I tried to seek out opportunities to volunteer where my friends weren't going. I tried to, so that when I would apply for a residency or I would ask for a letter of recommendation, it wasn't the same person that my friends were likely to ask. And on my resume, the places that I volunteered would stand out. So, for example, I volunteered at the LGBTQ clinic before I ever became a resident, and I was the first resident they ever had. I volunteered at the VA with Dr. Billy Brown, because he's like HIV pharmacist, so I volunteered with him. And I would just go, they only have HIV clinic like every Monday afternoon. And so the third year after I would finish, PBL, I would go over there. My friends were going home and they were like relaxing or going to work, and I would just walk over to the VA and volunteer my time. And I learned so much. I think that's the best advice, because I've done that throughout every aspect of my career. When I went to graduate school, I volunteered in the lab before I ever became a graduate student, and that volunteering allowed them to see what kind of person I was and how my work ethic was. And so it was that much easier for them to say, yes, we want her in the lab. And I think that's like the biggest thing that anybody can do, is to really volunteer. It helps you get your name out there. It helps you really decide what you want to do. And it creates opportunities that maybe you don't know you need or want. And it builds relationships. So I think that's the best advice I can give.
That's great advice. Just to wrap up, a few more questions. What would you say is your favorite part about pharmacy? And then what would you say is your most challenging part about the profession?
My favorite part, and this is going to be a very controversial answer, I'm going to say that now, is that I don't have provider status, so that I can see patients for as long as I need to. Because I'm really worried. I know that some of us want provider status as pharmacists, and I'm right there at the fight. I will stand with my pharmacy brothers and sisters and fight that fight, but I don't know what that would mean for the time that I have with my patients. So I love the fact that I can spend as much time as I need with patients. I spend hours going through patients' charts, trying to figure out what medicines they have been on, what hasn't worked, long before I ever make a recommendation about what medication to put them on. And I think I'm able to do that because nobody cares how much time I spend with the patient. And then you asked me the most challenging. So the most challenging part is building those relationships, because different physicians and nurse practitioners see different value in pharmacists. And so you really have to build relationships. I think that's the most challenging part, and understanding that the relationship that you will have with them is very different. So the medical director of my clinic, I have a great relationship with. I don't have to ask him when I make changes to his patient's meds. But then there's other physicians who I know want this whole paragraph about why I want to make changes. And then at the end of the day, I have to say, are you okay with that? Do you think it's a good idea? And just understanding that personality-wise, they're all very different, and just respecting those boundaries.
So one last question that I always like to ask is, if you have a student that maybe is considering, they know they want to go into the healthcare field, but they're maybe looking at dentistry or pharmacy or nursing or medical school, what would you say to really win them over for the profession of pharmacy?
Pharmacy is by far the most flexible. Right? We have pharmacists in academia, you have pharmacists in community settings. Pharmacists are like gods in industry. You have pharmacists in so many different settings, and I think they're able to thrive. That I think it really comes down to the versatility, while still being able to maintain a good quality of life, being able to have a family. I have friends that are physicians and nurse practitioners and dentists, and that's something that sometimes they feel like they struggle with, is just that balance of work life. And I think we do it a little bit better.
Absolutely. Well, thank you so much, Dr. Backus. It was so great to get to talk to you. To everybody that's watched out there, thank you so much. We look forward to seeing you real soon.